今アップしましたんで、ちょっと音が出てるかだけ確認しましょうか。
はい。
音声チェック。どうですかね。
どうですかね。待ってます。
はい。アップしました。
僕のは大丈夫です。
ちょっと音が出てるかだけ確認しましょうか。バッチリです。
で、僕の方は大丈夫ですね。
OK です。じゃあ行きましょう。
はい、行きましょう。Ladies and gentlemen, thank you so much for joining us when you join us. Hopefully you're watching us live, but if you're not, then bear with me. Good evening from Asia, good afternoon from Europe and Africa, and good morning if you're joining us from the Americas. Welcome to Kenji Ojima's YouTube Live International. What is this? Part 12?
Part 12.
Part 12?
12.
Part 12. Yes, we've done 12 of them so far. My name is Robert, and as always, I will be your MC and guide on this roughly 1 hour journey of learning. And joining me, as always, is world-famous orthodontist and incredibly handsome man, Kenji Ojima.
Hello.
Hello, Kenji. How are you?
Hello, Robert. Thanks a lot. Wonderful, kind invitation for me. So this week is just one time today. Normally it's twice a time per week, but this time is Wednesday. We have received the Professor Labinander lecture the same time.
Yes. How was it? Was it good?
Good, wonderful, very nice.
That's fantastic. I'm glad to hear it. So if anyone came looking for us on Wednesday, we were offline because there was a world legend was giving a Zoom seminar at the same time. And of course, we wanted to attend that. But welcome back. Thank you for coming back and joining us on Saturday. Today, we are going to be continuing our discussion from 1 week ago. Yes. 1 week ago, we started talking about accelerated treatments, and we covered 2 treatments. Both using accelerated orthodontic devices, OrthoPulse. Today we're going to be giving a Zoom seminar continuing that discussion, and we are going to be focusing on slightly more challenging cases. Now, both of these cases have been presented in the Journal of Clinical Orthodontics. They are top quality, and they are, well, get ready, ladies and gentlemen. You're about to have another international seminar quality presentation. Now, we have 2 cases for you today, and what we're going to do, instead of doing questions between, we're going to give both cases back to back and then do questions and comments afterwards. As always, we will be watching the live chat, so if you have any questions or comments that you want to write before you forget them, there is a timestamp so we can see when you ask them. Don't worry, if you have questions and comments, write them as soon as you have those questions and comments. And of course, if you are joining us again, if this is your second, third, 12th time, make sure you hit that like button so that we become more visible on YouTube. And if it is your first time, please subscribe and help us grow our channel. Ladies and gentlemen, we have something very special for you today. So I hope that you sit back and enjoy the ride. Kenji, would you like to take us into our first case?
Wonderful. So let's start again to this week special international YouTube Live, Kenji and Robot on YouTube Live. Okay. So today was one of the very challenging case I will show you. So okay, I have to change. Go to this one. Okay. Can you see that for this case? Okay. So this case is I and Robert. So we are already introduced for the last week in the Saturday YouTube Live. This case is anterior open bite narrow arch using a liner orthodontic. This is today's not main focus one. This is just introduction. Our team published on 2016 the Journal of Clinical Orthodontic At this time, our team is published on the article. This article is Invisalign system integration all-spouse device. Then we can use 3 days aligner change, swapping aligner very faster, acceleration. Then very important thing at this time I told you, face integration clean check, that we have to calculate how millimeter expansion, how millimeter alignment. That is very important thing. Then if we can use for the acceleration device collaboration for the aligners, so we are more high potential acceleration aligner orthodontic approaching. Okay, last time I will show you this patient, 3 days aligner change, 46 totally aligner. This is the aligners control focus on anterior region, the premolar canine anterior, expansion, alignment, extrusion. This is the finish. Okay, this is last week. I and Robert told about you. Then patient is compliance is good, and every day ortho using for 10 minutes per day. Okay, then 5 minutes upper, 5 minutes lower. Then using ortho device over the aligners. Then we can do 3 days aligner change for this patient. Just 5 months finish. This is the initially planning, the finally. This is the no root resorption. This is the initial final retention. Not only acceleration orthodontic. This is a 4 years retention. It's just very stable. Alignment is good. Midline is correct. The canine and the molar side is a good occlusion. This is a 4 years retention photos. Okay. Based on this patient, the today topics is more advanced one. This is an introduction. Okay. This article, this patient is an introduction. We can do 3 days aligner change. It's possible to Invisalign system. The case 2 is today's main focus. Okay, today's main focus is this patient. Our team published on 2018 Journal of Clinical Orthodontic. These topics is upper molar distalization with Invisalign treatment accelerated by photobiomodulation. This theme is very big keyword, 3 contents. Initially, last case I told you using photobiomodulation is very effective, very predictably tooth movement for the anterior region, canine premolars. Because this patient focus on molar control. Okay, this is not only anterior region. We have to need control
with. Sorry, yes. So once again, with OrthoPulse, OrthoPulse 1, you are only covering the anterior region with OrthoPulse. So
exactly. So the
anterior teeth.
Yes, exactly.
Okay.
So the OrthoPulse 1, the current model is a cover to premolar to premolars, normally, not full cover to the full arch. Okay, but this article is I am a key opinion leader, KOL for the Biolax company. Then so the Biolax company is produced to OrthoPulse device. So the Biolax company is given to me. So the prototype device name is OrthoPulse 2. Okay, OrthoPulse 2 device is you can see cover to full of the arch, up 7 to 7. Okay, then another big point is second one is this OrthoPulse device is we can control effect area only molars or only anterior or only premolars. OrthoPulse 1 device is effect area is all over the range, okay, premolar to premolars. But this device, we can choose effective area. For example, initially upper molar distalization time, we can only contact, only affect area second molar, first molar region. Premolar to premolar is not affect photobiomodulation. What do you think this is meaning? It's very important.
That's a big advancement.
Yes,
that's
exactly.
Amazing.
Yes, exactly.
That's amazing. Yeah.
Yes. So you
can better perform sequential movement, right?
Yes, exactly. So the only focus on photobiomodulation effect molar region is this meaning is mobility is more high, the molar side. But the premolar to premolar area is mobility is normal, not for the, how I say, very good for the anchorage, right? We can separate anchorage region and the control region, okay? This is second meaning for this JCO article. Third one is very important thing. The many of the doctors is cannot possible to the motor control for 3 days aligner change. Until teeth is very small and the canine is a root is one root, but please have a look this patient. The molar side is every single patient is a molar have almost 3 or 4 root. This is significantly very difficult to control. The specialty this article is using aligner only, without any tat, without any braces. Only aligner we can use for the photobiomodulation effect, for using for the photobiomodulation effect for the orthopulse device. 3 danger aligner change. How can we aligner possible to the molar distalization and prevent anchorage loss? Okay, this is a 3 big thing. Initially, this patient have to need molar control. Second one is we can, how I say, control segment effect. And third one is a molar side, very difficult to tooth movement, but we can do control and we prevent for the anchorage loss. Okay, this is device. Orthopulse device is a left side. Is a current model Orthopulse 1 is a right side. Okay. Easy to understood is watching for this device. What is different point is a range. Okay, the cover to cover is we can use distal extension version is totally different for the length. Okay, then so that we can use for this Orthopulse device more control distal movement and intrusion, extrusion. And some of the time we power off to the premolar region, but still continue power on to the molar region. We can change the level. That is very important thing for my approaching. So have a look. This patient is we have to need molar distalization at this time. Very important thing. This device is more better control. You can see this change color area is effective area initially. Initially, we control only molar region is a effect of photobiomodulation and the mobility high for the around the molar root. Then easy to control aligner change for the 3 days. Initially, this patient come to my office. As you can see, this patient is upper right first premolar already extracted. Upper left lateral incisor is already missing. Okay, so this patient is opposite. I have to change. So that these photos, just hold on. This is good. This is good.
So this patient had already received treatment. How long before coming to your office?
So this patient come to my office. So this patient is a retreatment, okay? Because this patient is already received orthodontic treatment since junior high school days. And this patient already. Sorry, I have to information again. This patient upper left first premolar extraction already, and this patient. So the congenitally missing upper lateral incisors, upper right, okay. Then so that this patient already missing for the upper 2 teeth, already finishing for the junior high school day orthodontic treatment. Then the patient come to my office. Very important thing, we cannot for the extraction approaching because this patient already extraction upper arch, okay. So we have to need more distalization. Okay, this is the patient information for the initial time. 25 years old female patient, cheap complaint, severe overjet, 1, 2 missing, and already 24 extraction. The relapse case. Now we have to do my planning is after alignment orthodontic treatment, reshaping 1 2 2 1 3. Go to the canine shape. My treatment planning is upper molar distalization and the distal extension device, and we use 3 days aligner change for the aligners. This is the initial situation for the OPG and the SEF for this patient. Initial phase, the severe overjet, and this patient is a definitely anterior open bite. Sorry, this is a Japanese language. For this patient, initially scanning for time is November 12, is 2015. Okay, initial time. Then I accept for this patient clean check. I accept November 2015. Okay, then started treatment for this patient. Sent to the aligner November 2015. Okay. Then this patient, I take again 2016 June, take a scanning, then send the aligner. This is a retainer. We take a retainer scanning for this patient. Total treatment time is very, very short. Okay, have a look. This patient.
7 months? Wow.
11.
Okay. That's just amazing.
Yeah, I think so. So this patient is a definitely good compliance for this patient. Then initial situation, we take extraction upper both sides, 1A, 2A extraction, third molars. Then wear the aligner initially, then place all the attachment on, then started to using elastic, going to upper molar distalization. Of course, at this time, we use OrthoPulse device 2, the 3 days aligner change. Please have a look. You can see upper second molar distalization. Then after that, started to distalize upper first molars. After first molar distalization completely, then started to upper premolar distalization both of sides. After premolar distalization, then started to the canine retraction. Finally, anterior retraction. Okay, as you can see, this patient is good for the compliance and good for the tooth control, except for the anchorage loss. You can see this is the lateral view. Lateral view is initial time here, then upper second molar distalization, then started to first molar distalization phase. After that, premolar distalization, then canine, finally anterior retraction. This is final situation for this patient. In 3 days aligner change, 76 aligner, total aligner. This patient total treatment time is just 1 year, 12 months. If 1 week aligner change, 90 months have to need it. And if 2 weeks aligner change, have to need 36 months. That is totally different is treatment time. Okay, 3 days aligner change and 70 months, totally different. Initially, the face is this, and we have to check for the face integration. The teeth position is good for the smiling. This is finally, so the OPG and the SEF. We have to compare this initial and final for this patient. We can easy to understood upper molar distalization and control anterior teeth. And finally, is not for the lower molar is tipping, is a good control and a stable anterior incisor and the lower incisor too. This patient is a 4 millimeter molar distalization and a good for the control. Then we can do nice tooth movement. This is this is a totally different approaching. Or if the 7 days aligner change, this patient is a Invisalign collaboration acceleration device. We can do more expand approaching. Okay.
Absolutely, it's just incredible. So Kenji, did you feel that the OrthoPulse 2 was giving you better results than just the OrthoPulse 1 doing only anterior coverage would have?
So if we can use for the also Pulse 1 device, is some of the time we have to control this using like this. We call it
Right, okay.
MEP, molar effect
MEP.
position, like this.
Okay.
Yeah.
So manual repositioning.
Exactly.
Okay.
But this is what is different one is MEP is good effect for the molar region, but all of the arch is a photobiomodulation effect. Molar
see.
distalization phase, so we don't want for the effective because this is anchorage, right? Anchorage,
Right, of course.
we want to focus on only molars. This is good. Mobility is high, easy to control, but this area is mobility is normal is good. But the OrthoPulse 1 is using for the MEP position, all of arch is effective. But the OrthoPulse 2 device is using like this position, but the only effect here and here. This is not turn on, not effect for the biomodulation. That is very important.
As you showed at the beginning of the presentation, you are able to target just the molars while maintaining anchorage with those less well-anchored front teeth, anterior teeth. That's a big advancement.
Yeah.
That's a big advancement. And so is OrthoPulse 2 available on the market yet?
So some of the doctors already use it, but only key opinion leaders. So will be released is the end of the 2020 or 2021 is first for the quarters. I hope.
Yeah, it sounds like it. This is quite an amazing case. Ladies and gentlemen, why don't you tell us what you thought? Please do not be shy. The chat line is open. If you have any comments about this case, if you have any questions about this case, please direct them to the live chat, and we will take them in turn. We have one comment already from Dr. Kazuno. こんばんは、先生。
こんばんは、先生。
And
says,
wow. And the timing of his wow was when you showed the OrthoPulse 1 and the OrthoPulse 2. When you showed both on the same slide, it was quite a reaction that I think we got. Thank you very much for your reaction, Dr. Kazuno.
So I understood because everybody think about is aligner is cannot possible to the switching aligner the too fast, especially molar control time. But this patient is good for the compliance, and this patient is a retreatment. This patient is already understood. Is a orthodontic treatment time is very important thing. Is a continuous is routine works. This patient is a good compliance patient using every day, so the 20 hours per day, and every day using OrthoPulse device. At this time, we management for this patient schedule time. Every 2 weeks, come to my office and take photos and check for the aligner and the tooth is good control or not, and take a photo documentation. Then so the support to every 2 weeks. But the patient is very nice and using elastic, that is very important thing. Then so they're good for the molar distalization. After that is a good for the stable molars. Very difficult control like this situation is a molar distalization. That is normally. But easy to anchorage loss is very difficult, right?
For sure. So the overjet, was the overjet of the previous treatment? Was that sort of a rebound effect from the previous treatment, that overjet, that overbite?
Yeah. So
was that from the previous treatment, or was that, did she originally have that?
Yes. So normally, so we have to overjet control is very, very difficult. Everybody easy to understood is using TART, but this patient without any TART, only aligner, elastic is acceleration device. We can do it.
That's fantastic. All right, so we're getting some questions. Let's turn to the live chat and field some questions from our wonderful viewers. Thank you all for coming out and joining us. We are happy to be getting into our engaged discussion with you. If you're new to the discussion, please hit that subscribe button. If you're not new, but you haven't hit that like button yet, hit that like button as well. Help us grow this channel and attract more intelligent compatriots like yourselves. Our first question today is from Dr. Edgard Irani. Hello, Dr. Edgard.
Edgard, hello.
Welcome back. Edgard asks, does photobiomodulation affect the stability of TADs?
Dr. Edgard is a very nice question. So that everybody think about if using photobiomodulation is a tooth mobility high and easy to is falling down is TAD. But photobiomodulation effect is also pulse is before using not orthodontic area. This device is a before orthodontic area is using implant, dental implant market. After dental implant placement using photobiomodulation is a bone healing is around cover to the fixture is more faster. So the dental implant placement after that is good for the bone, how I say,
Reshaping. Yeah? The bone reshapes.
Yes,
that's right.
That is good. So this is good. Then some researcher is think about if this effect, if using for the orthodontic area is more good for the tooth movement more faster. Then this meaning is using TAD and with orthopulse device is very stable for the TAD. TAD is no problem, but the tooth movement is more faster.
Great. Well, thank you very much for the wonderful question.
Yes.
Wonderful. And a great answer. Thank you for the history lesson, Kenji. Thank you.
Thank you.
Okay. Next, we have another returning face, Dr. Mahesh Gondi. Hello, Dr. Mahesh.
Mahesh, hello.
Says, hi, guys. Does orthopedic one size fits all?
Very nice question. Mahesh. So this is, I use this patient is around 2015 or 2016. So 4 years ago, but at this time only one time. But I hope is if release for the end of this year or release for the next year first, at this time some adjustment is better, but if small arch patient is enough to orthopulse 1, okay? Small arch patient, some of the time is easy to MEP, but if more longer, at this time is orthopulse 2 device is better. But orthopulse is this area is very soft, not too hard one. If for the hit for the end of this area, but not too tough time, very, very comfortable. This is no problem.
Okay, so the material is a soft,
soft.
Plastic or silicone?
Silicone, like this.
I see. Okay.
Very soft.
Okay, I see. So very little irritation if it's too long.
Yes.
I see. Okay. Great. Thank you very much for your question and continued participation, Mahesh. Thank you.
Mahesh, thank you.
Okay. Next, guest and frequent question asker, Spam X4. Hello, Spam X4.
Spam X4.
Spam X4, welcome back. Spam X4's question is, do you use photobiomodulation on every case now?
So nowadays, many of the patient is already is a word of the mouth. Then this patient is and then so the introduction of our office at this time, another patient is already knowing for the what is orthopulse device. At this time is not for the introduction, but they already know it. They already want it. At this time, okay, if you want, it's better. But not for every single patient, because some of the time no needed, especially for the young generation, the teenager. At this time we have to observation to the growing of the bone. At this time no needed. But some of the times the patient want to more acceleration approaching because 1 year later, so the wedding ceremony I show you last week. And this time I introduce this is acceleration device if you want, so that I use it. Not for every single patient. It depends on the patient wants, depends on the situation, both.
For sure, for sure. So, of course, the second half of the question is, would you do the cases you do without it? The answer is yes. Of course, Dr. Kenji does not use the photobiomodulation for everything, and there are plenty of cases that either don't need it from a clinical perspective or don't require it from the patient need perspective. So, as usual, case by case, depending on patient needs, right?
Yes.
Okay. Well, thank you very much for your continued participation and viewership, Spam X4. You have a very awkward name, but we love you. Thank you.
Thank you.
Okay. Next, we have another question from Dr. Mahesh Gondi. Hello again, Dr. Mahesh.
Mahesh, hello.
Dr. Mahesh says, how do you manage to distalize the second molars without any attachments?
So thanks a lot. Wonderful question. It's many of the time I had a lecture, a seminar, my course. At this time I explain about this question. So that what is more good, effective tooth movement for the attachment? My answer is all the time is the same. Second molar is normally I don't place on any attachment. Because second molar is a big crown shape, so that easy to gripping for the aligners. And the second reason is if placed on the attachment, if just a little bit with a different position, already started to unfitting. I don't like it. Take a scanning, we can get precisely tooth shape. Then aligner is easy to gripping, completely perfect. But if placed on attachment time, just a little bit different position, different area, and not remove 100% bodies, it started already unfitting. I don't like it. So the second molars, specialty upper, except molar height, crown height is very short. And this time I place on some attachment, rectangular attachment, but the normal shape, normal size, natural teeth, and this time I don't any attachment for specialty upper molar distalization time.
Thank you very much, Kenji, for your wonderful answer. Yeah, the teeth that have coronal surface area really do let you take advantage of the aligner ability to grip and move. So not particularly necessary, but thank you for your wonderful question, Dr. Mahesh.
Thank you, Mahesh. Thank you.
Okay. We have another returning guest. We have Dr. Gustavo. Hello, Dr. Gustavo.
Hello, Gustavo.
Yes. Dr. Gustavo says, how many days do you change the aligners without photobiomodulation?
This is a very nice question. So it depends on the situation. But normally is a molar distalization time. Some of the time 1 week, some of the time 10 days, some of the time 2 weeks. So especially young generation. So the initial eruption staging patient. At this time we are waiting for the second molar eruption. At this time 2 weeks aligner change. 2 weeks aligner change, 2 weeks. And 14 to 16. At this time, normally 10 days aligner change, okay? Because easy to control, but we don't want for the rush because we don't need for the, how I say, acceleration approaching because eruption, waiting eruption, completely eruption on the lower second molars, we have to check which position is good or not. And some of the time, just a little bit still growing up maxillary bone. Now, after 18 years old, after 18 to 20, it's no needed 7 days, some of the time, 5 days. It depends on the root, depends on the bone situation. It depends. But normally like this, without any acceleration device.
Okay. And the second half of Gustavo's question is, do you change the movement speed on your ClinCheck in these cases?
No, this is a normal speed. So that I all the time talking about in this YouTube live, our YouTube YouTube Live. So around 2013 to 2014, at this time, 7 years ago, 6 years ago, at this time, some of the time, I speed down for the one aligner velocity. So just a little bit for the speed down, the one aligner 0.125 millimeters. But nowadays, around these 3 years, I don't change any aligner speed, normal speed, one aligner 0.25 millimeters.
Okay. Yeah, finishing treatments as quickly as possible. When you start to, so one thing that Kenji often talks about is learning to trust clean check. And once you learn to trust your clean check, your own skill, your own mastery, then you can really read ahead. You don't need to slow down the treatment time. You can keep it at full and still get the results that you expect. Well, thank you very much for your question, Dr. Gustavo.
Thank you, Gustavo.
Okay, our next question comes from Lynn L. Dr. Lynn L. Hello, Dr. Lynn.
Hello, Dr. Lim.
Dr. Lin says that I noticed that in some of your cases, you distalize the upper premolars together, but for this case, you distalize so they moved separately. When did you decide? How did you make this decision?
Very nice question, Dr. Lim. I will show you for this one. Okay, I will show you again. You can watching precisely. Initially, started for the distalized second molar, then after that the first molar distalized. Please watching carefully. Right side is distalized 2 premolars, but the left side I distalize 1 premolars. We can do it both. Some of the time 1, some of the time 2, but it depends on the situation. It depends on your planning. Normally is a very difficult way is 2 premolars same time for the distalization, because at this time we have to think about anchorage and control, and we will not prevent for the anchorage loss. But this patient is good for the using rubber band and good using aligners. Then so that I do this patient premolar same time. Then after that canine. The canine is just a little bit different situation for the root, just a little bit longer and just a little bit for the, how I say, more difficult to movement. But premolar some of the time very easy to control like this. And right side is a both, left side is a single. So if you want to single tooth movement for the premolar distalization, you can do separate. And some of the time, it's my approaching nowadays, very new one, is premolar is the same time. But the very important thing at this time, add directly bonding hook, the premolar is more safety. If 2 premolar same time. The right side is a 2 premolar same time, put on the directly bonding hook, then control. Right side is only one, is without directly bonding hook on premolars. Direct bonding hook you can see put on the canine.
Okay. Thank you very much for your question, Dr. Lin, and your answer, Dr. Ojima. Thank you, thank you, thank you.
Thank you.
Right. So yeah, we do have some unique considerations in this case. You have the pre-existing treatment consideration. How often do patients come to your office with previous treatments? What percentage of your patients have previous treatments?
So before the coronavirus situation, so every single patient is one time per month. But now, so we can start it for the remote control of orthodontic treatment. So we use for the OrthoComm device. Then so that we receive the patient photos, then check for the aligner fitting. Then I use for the Zoom. Some of the time we use for the online communication for the patient. Then nowadays is some patient one time per month. Sometimes, but another patient is one time per twice 2 months. Now we arrangement. Some patient is 3 months, every 3 months, or some patient is 2 months, just a little bit, just longer, because we use for the online treatment support started after with coronavirus situation now.
I see. So, do you think that what is the patient response? Do they like the online treatment support?
Very nice, unbelievable, because this patient nowadays, so every single patient easy to accept for the online communication, because the patient want online communication is better. But before coronavirus situation, why so the Kenji is not open for the clinic? I want to go your clinic. I want to talk with you. But now is a patient think about which is better way is stay home and take photos on the taking for the online is more safety. Then our team staff and me and the patient understood we can use IT tool. The specialty aligner orthodontics is very easy to connection to the online support. That is amazing.
Yeah, I think so too. Here in Japan, we have lifted at the beginning of last week, and our government, the message is, ladies and gentlemen, the restrictions have been lifted, but let's work together to build a new normal. Let's life. So maybe online treatment consultation, online treatment monitoring will become part of the new normal of your orthodontic practice.
Yeah.
Here's hoping anyway. SpamX4 has a question for you. This is a question that we have a number of times, but it always bears repeating. So thank you, SpamX4, for your question. And SpamX4's question was, do you use dental monitoring?
No, I don't like for the dental monitoring because this is not for the doctor's decision. This is only AI. I don't like AI because nowadays is if maybe 5 years, 10 years later, that is some of the time AI control is everything, but doctors have to need checking all the time because the only aligner fitting on the tooth, then so the next switching for the aligner is sometimes very dangerous because AI and the dental monitoring is not understood patient pain, okay? Not understood the patient midline is deviation. Not understood patient is flare out anterior teeth. We take photos, patient take a photo in the house, sent to my office, at this time using OrthoCommunication, OrthoComm, okay? OrthoComm is, this effect function is normally, so the normally including this function. I send to the OrthoComm app, then the patient using take a smartphone, then so the easy to, okay, I will show you. I will show you now. That is more easy to understood the SPAM X4, right? I will show you remote communication. What is this? Remote communication. Can you see that, Robert? This is we call the OrthoCommunication software apps. OrthoCommunication is easy to send to any single patient. The patient take photos of not only teeth, very important thing, the face and the aligner fitting the teeth. Because some patient is this patient want to more retraction anterior teeth. At this time we have to check the patient face, not only teeth. Okay, the patient is take a photo like this face teeth photo with aligner, then send to my office. This OrthoComm app is easy to how I say separation. ロバートさん、この紐付けって紐付けるんですね。オルソコムはね。
I see. Yep. Right. So it's easy to tie together.
Yes.
And reference all of the data within the system.
So exactly. For the tie together for this device, take photos for the patient self, then so that tie together to the my office also communication software. Then we check for the patient photos. Then so the aligner fitting is good. So okay, step up for the new aligner, and some of the time, every single step up time, take a photo sent to me in my office. So before the coronavirus situation, patient come to my office once a time per month. But if using like this, what is different point is the patient take photos and send a photo every single step. We get it for the many photo data. That is very important thing. Then we use for the online communication. Is good, no pain, and the aligner fitting is good. Do you have any problem? I ask to directly using for the online communication. That is my approach, not for the dental monitoring. That is totally different. Thank you, SpamX, for.
Yes. And one thing that I like about, I'm not an orthodontist, but I am familiar with OrthoComm. One thing I really like about OrthoComm's interface is that the patient side application and the doctor side application, it's very easy to share images from patient side to doctor side. And then once they're shared, they're organized within the patient profile so that all of your facial photos, all of your immediately with a slider, you can see which day, which stage, very quickly. So when I first heard about trying to organize, put them where they need to be, but for you with the patient side app, you say, and it sends to left side up, and it's all organized for you. It's quite a robust and incredible system, I think.
Thank you. Wonderful question, and thanks for that wonderful explain the robot.
No, hey, you're very welcome. It's very difficult. Dr. Ojima uses a lot of different functionalities in his workflow that he takes for granted, and it's very difficult when you have to explain it. That we typically have to explain on the day-to-day. But again, yeah, if you have any questions about Dr. Ojima's workflow or how different types of, those questions are always welcome as well. So thank you very much for your question, SpamX4.
Some days I want to explain what is different point for the dental monitoring and also OrthoComm device on this YouTube live.
I would love to be a part of that conversation, and I think that the 30-plus members in our conversation would be interested in hearing that as well.
Thank you.
All right, ladies and gentlemen. Well, it looks like our chat. No other questions and comments.
Okay. So we just is a good timing today.
I think so too.
Yeah. Thanks for watching.
We are just, we're finishing up right at 10:30. You have been an absolute wonderful audience as usual. Thank you for your questions and comments. We will be back with you on Wednesday of next week.
Yes.
As usual, we'll be coming back 2 times a week, Wednesday and Saturday. Same time, same place. Come join us at 1:30 Central European Time or 9:30 Japan time. We hope to see you all. And once again, the world is the situation. Many of us have to some our old lives. Many of us are going to work. Some of our children are going to school. We're seeing some of our friends again. But it's like we said just a few minutes ago, there needs to be a new normal. We have to shift back into a comfortable day-to-day life in a way that is safe and sustainable. So we hope that you stay sustainably safe for the next few days until we see you again on Wednesday. Thank you all for coming out and joining us. Thank you. Kenji, do you have a final message for our viewers?
Yeah, thanks a lot for my friend and the robot. So I'm very exciting for the using for the this for the YouTube live. So see you next week on the Wednesday. So that this time I'm very exciting for the topics I will talking to you. Thank you.
Thank you all for coming out and joining us. Kenji, do you have a final message for our viewers?
Yes, thanks a lot for all I'm very excited for this for the YouTube live. We'll see you next week on the Wednesday. That this time I'm very exciting for this time talking to you. Good.